Now I'd like to introduce Dr. Mark Meloche, who's the Medical Director of Quality and Transplant Hospital Liaison, as well as Medical Director, Pancreas Islet Transplant Program at BC Transplant, the government agency responsible for coordinating organ donation across the province. Dr. Meloche is also Director of Undergraduate Education for the Department of Surgery at UBC Medical School, as well as Head of the Surgical Transplantation Section at Vancouver General Hospital. Dr. Meloche will speak about organ donor registration in BC. Thank you.
Thank you, Anne. And thank you, the Kidney Foundation, for allowing BC Transplant an opportunity to say a few words. It's always hard to follow Adira and David because they speak so eloquently, and they had very good news stories to tell you, especially, I think, some of the differences in the changes that have been brought on with the nephrologists and the different domino transplants and the highly sensitized patient transplants, and I think that's should be applauded. It's a very big success story. It's made a big impact on the waiting lists and then the composition of the waiting list for people that might wait a much longer period of time. So what I'll do here, I don't really have much to tell you about other than maybe introduce who we are. Most of you would know us one way indirectly or maybe directly with the transplant or some other activity. But we are, I'm here representing the BC Transplant, and we're an agency of the Provincial Health Services Authority, like the Renal Agency, and we provide oversight for all aspects of organ donation and transplantation across BC. And that's broken down also in a few physical buildings and areas of activity. We have 3 transplant centers: St. Paul's Hospital, Vancouver General Hospital, and Children's. And we also have 8 post-transplant clinics that people are involved with around the province. They're evenly distributed, and Nanaimo was to come on in May of this year, which is today. And we do, from the organ donor side, and Dr. Landsberg mentioned that we have living donors and cadaveric donors, or deceased donors. And from the living donors, we not only do kidney transplants, we do liver transplants. And from the deceased donors, you can see the list here: kidney, liver, heart, lungs, pancreas, pancreatic islets, and cornea. And as you heard earlier, that diabetes is becoming a bigger component of renal disease. We're looking at trying to prolong some of the life of some of the kidney transplants, either with pancreas or pancreatic islet transplants. So what is our role with organ donation? We, from a policy point of view, we develop and maintain the policies for the province, the professional standards and the clinical guidelines. And this is our responsibility as BC Transplant. We also provide a direct hands-on delivery of the service for organ donation across BC and interprovincially. We manage donors in pretty much every hospital that has an ICU, that has a ventilator across the province. We will send teams out to work with the hospitals. We have in-hospital support for the organ donation process, and we provide the logistics for the deceased donor and the living donor, kidney donation and other donations. So the retrieval program is a big process for us. One other aspect for the last number of years is we manage the province's organ donor registry, and as you know, that's at 19%, and hopefully part of this meeting will be to encourage that, to figure out ways to allow that to grow and to support that. We also are engaged with organ donor awareness programs and education programs across the province. And there's a new player since the Creever Commission, is the Health Canada. And Health Canada has some fairly strict guidelines as to that sort of describes how we play the game of transplantation and how we work up and investigate organ donors. And it's really to make sure that what we're doing remains regulated and remains safe. And it's for the benefit of all the people who would be recipients of organ donation. And they have a fairly strict set of rules that we have to play within, and we set up the ways that we do that, and we maintain this with our QA programs to make sure that we fall within their guidelines and what is required with that. And just and very briefly, I only have a couple of data slides, but what we've done in the last 5 years, let's say, to implement change, and you'll see that on the data, two of the increases that we think have made a significant impact in organ donation was first to establish in regional hospitals in several areas around Vancouver, on the island, and now in the Valley and in the Okanagan, to support organ donation in the hospital at the ICU or emergency level. We still have some work to do there. We still have to hopefully work with the hospitals to set up the clinical triggers to identify a suitable organ donor early so that we can get engaged with the family, get engaged with the process, provide support to the family, support to the care providers in that situation so that we don't lose an opportunity to have an organ, potential organ donor to convert to an actual organ donor. And we've also expanded the death after cardiovascular death, or DCD, and we initiated that within the Vancouver area, and now we've expanded that to areas outside of Vancouver, in the Valley, in Okanagan, on the island, and that, you'll see, has made a significant impact on the number of donors over the last 4 years. So just a couple of data slides. This is an overall look at the deceased donors that we have managed to convert to an actual donor opportunity in the province. And you'll know that this goes back 25 years. In 1995, we were looking at about 50 donors a year, and that number started to tail off for a variety of reasons, and by 2005, we reached our nadir at 25 donors, which was really an insufficient, by far, a far too small number based on our population, based on the opportunity that we had. And this is when we got engaged again with the hospitals, and by 2008, we started working more with the ICUs to make sure that we captured all the opportunities. Also, by 2010, we started with the DCD program, which added more donors to our list. And you can see then from 2010 onward, that line splits. The red is the traditional brain-dead donor. The blue is now a donation after cardiac death donor. And when you look at the sum over the last 3 years, we went from a low of 25 in 2005 to a high of 70 in 69 last year. So our numbers have significantly improved from the organ donation side over this period of time. It's not that they're where they should be, but they're certainly moving in the right direction. And just looking at some of the issues, one would say one of the problems is that we're not considering older or younger donors. Well, we actually have started to consider more often, or get the opportunity to consider more often, older and younger donors. And although the mean only goes up from 35 to just below 50, when you add both older and younger donors, the mean shouldn't really change much because they sort of balance themselves out. So that doesn't really represent what we're doing. But if you look, and it's a little bit busy, but the 55 to 69 and the 70 and older lines have gone up over the last 5 or 6 years. And we're considering more donors. We're extended criteria donors, as Dr. Landsberg pointed out. We're putting older kidneys into older recipients, and it's working, and it makes sense, and it allows us to utilize all these opportunities that present themselves. So that's another plus that allows us to expand our numbers. The transplant number overall, if you look at prior to 1998, the living donor number was significantly below the deceased donor number from a kidney transplant point of view. But with the efforts of our nephrologists and the transplant nephrologists in the province, And the push for living donors, that's been a significant success story for organ donation in the province and in Canada. We do very well from a living donor point of view. And if you follow the slide here, you'll see that as our deceased donor numbers have gone up over the time, so have our living donor numbers. Not to a great extent, but enough to put us up to over 200 kidney transplants a year. Unfortunately, if you look at our challenge, and these are the people on the renal list, as it was mentioned earlier today, there's 361 people waiting already on the kidney transplant list. And this is the high and the low. As our numbers were dropping down, certainly before 2000, the people on the waiting list was going up significantly. As our numbers now are again rising, especially with the living donation side, it slowed up or reduced the number on the waiting list, but there's still too many people on the waiting list, and which is why you're all here, and which is why we're having this gathering to see if we can improve on that. And just one other slide, my last slide. Last year, we did 326 transplants across the province, and this is just a breakdown of who we transplanted. Not only were there 205 kidney transplants, we had 64 liver transplants, 24 lung transplants, most of which were double lung transplants, and 22 heart transplants. So organ donation is a big impact on the renal group, Kidney Foundation. It has a big impact also on a number of other groups in the province. So the effort to increase organ donation is certainly one that would be appreciated across the board. But thank you.